Hello, everyone. I call the Charlottesville May 19th, 2025 meeting to order. Charlottesville City Council meeting to order. Ms. Robinson, will you please call the roll?
Yes. Councilor Oshrin?
Here.
Councilor Payne?
Here.
Councilor Pinkston?
Here.
Councilor Snook?
Here.
Councilor Wade?
Here. Is there a motion to approve or amend the agenda?
I move for approval of the agenda.
Second?
Okay. Can we vote?
That's me. Let's try this again. Here we go.
Okay. Okay, the motion passes 5 to 0. The meeting will be divided into three sections. The first section is the work session, to hear and discuss presentations that do not require a council vote, followed by a closed session, and then the city council business meeting at 6:30. Today, we will have two reports. One is on the homelessness focus in the community briefing, and then a report from the annual youth council annual report. So, Mr. Sanders, will you?
We'll turn it over to Deputy City Manager Marshall.
Okay.
Good afternoon, Council.
Good afternoon.
It is a pleasure to be in front of you to talk about such an important topic, but more importantly, it's my honor and privilege to pass it on to our experts in the community who do this work day in and day out, and without their dedication, time, effort, and expertise, unfortunately, many members of our community, our neighbors and friends, would face immense suffering. So for today, you're going to hear from several of the members of our nonprofit community, starting with our Continuum of Care lead agency, Blue Ridge Area Coalition for the Homeless, often known as BRAC. We'll hear from The Haven, from Shelter for Help and Emergencies, often known as SHE, from our Salvation Army, as well as from Pacham. So just briefly, just a reminder for you all and the community that homelessness is extraordinarily complex, and it is a pressing challenge within our city, but also within the Commonwealth and the nation. It impacts individuals, families, as well as broader community members. And the City of Charlottesville, I'm very thankful to say, remains committed to advancing equitable solutions through collaboration with our nonprofit partners, regional partners, and most importantly, listening to those with lived experience to find out what they need, not what we assume that they may need. So we're honored to provide this briefing workshop to you and the community to learn more about the state of homelessness here in our city, the work that our nonprofit partners are doing, and for many of them, the work that they foresee doing. You have a list of presenters in front of you as well, but it's my honor to turn this over to Ms. Shayla Washington, who's the Executive Director of Blue Ridge Area Coalition for the Homeless.
Thank you, Ashley. Hello, City Council, City Manager. My name is Shayla Washington, and I have the pleasure of serving as the Executive Director of the Blue Ridge Area Coalition for the Homeless, also known as BRAC. BRAC aims to make homelessness rare, brief, and non-recurring by collaborating with communities to help both individuals and families achieve housing stability, financial health, and improved quality of life. We serve as the Continuum of Care lead agency, which is responsible for the annual application process for federal funding through HUD, also known as the Department of Housing and Urban Development. We're also the lead body for state grant management through the Department of Housing and Community Development, as well as developing policy, improving the performance of homeless service providers, and managing our COC-wide homeless management information system, which has about 65 users. We also provide overall coordination and collaboration amongst and with all the service providers across our continuum of care. So you'll see on this graphic here, this is just kind of a snapshot of all the different buckets in our continuum of care. One agency I did neglect to leave off by accident is under the yellow circle on the left-hand side under prevention and diversion. Piedmont Housing Alliance is another really great program that helps with prevention for addictions. But yes, this is covering everything from outreach, coordinated entry, affordable housing, transitional housing, emergency shelter, rapid rehousing, diversion, and permanent supportive housing. And we really need help in all of those buckets to really make this a strong continuum of care. Another BRAC responsibility is our point-in-time count and also the housing inventory count, which happen on the same night. This is a HUD effort, and it happens the fourth Wednesday of January every year. That's where we go out and assess who is staying in shelters, who's staying in transitional housing, and who is sleeping outside. So you'll see those three different lines representing those three different categories. Just to provide some explanation, in 2025, so in January of this year, we saw 41 unsheltered folks, and that's that dark blue line at the very bottom. The middle line, which is the middle blue color, is transitional housing, and you'll see a little decrease in that. We served 8 individuals this year in 4 households, but there were some children taken away from the home in early January, which is why there's a decrease in that number. We only have 4 transitional housing units online at this point. And then there were 116 people sleeping in emergency shelter. Previous years, just for comparison, 2024, we saw 126 people sleeping in emergency shelter, 14 unsheltered, and 19 in transitional housing. So you can see the increase in the number of unsheltered folks went from 14 to 41 in the last year. And I think some of that was in part due to me transitioning into this role, not having enough robust number of volunteers to help assess all the different areas. We also had some input from other counties this year. As you can see on our by name list, or the BNL as we call it for short, that's a list of everyone we know to be experiencing homelessness at any given time. We try to keep this up to date in real time as much as possible, given all the providers who are giving information into our system or our HMIS. We approximate having about 220 people on the list at any given time. That's up from last year. We usually had about 200 at any given time, but that number is slowly increasing year over year. For the last year, from June 2023 to 2024, we had 498. Fast forwarding 1 year, we have 571 people. So again, we're seeing that increase going up for people who are unsheltered or sleeping out in a shelter or transitional housing. Anything that's paid for by a third-party service provider, like hotels, all of that counts towards people on our by name list. Currently, we have 241 people on our by name list. So the next slide shows you a breakdown. Where are the people who are unsheltered or sleeping in emergency shelters from? We have 241 people on the list. 157 reported where their last permanent address or locality was located. 107 of the 157 reported being from the city of Charlottesville. So that equates to about 68%. Of the total by name list, that would be 44% of everyone. But as you can see, we had 84 people who we didn't collect the data on. We are going to be having a data quality training for all of our users next month, actually. So hopefully we can start to ease down that unknown data not collected section. But as you can see, the vast majority do come from the city. And this is just a slide kind of detailing that. So 68% reported being from the city of Charlottesville, 25.5% reported being from Albemarle County. The rest all came from either Nelson, Louisa, Fluvanna, or Greene. So what's up next for BRAC? We are in the process of hiring an outreach coordinator through private funding for 1 year. This is just a pilot program for us, trying to see what the need is throughout the COC. So we also cover not only the city of Charlottesville, but the counties of Albemarle, Fluvanna, Greene, Louisa, and Nelson. Once we do have that outreach coordinator hired, we plan to create a lived experience advisory council that position will be heading up. We continue to do a lot of outreach with our fellow COC lead agencies across the state. There are 16 of us. We're working on, of course, creating an advocacy because we can see that the need for HUD dollars is stronger than ever now. And we're just kind of working on improving systems and policies and procedures across the COC. So we are working on a strategic planning process. We just got approved for funding through Virginia Housing, so we'll be embarking on that process starting next month and doing a strategic plan not only for BRAC, but also for the whole continuum of care to see what the needs are. So we'll be interviewing different stakeholders, nonprofits, community members, city council members, city manager, just to see, what are the needs, where can we fill in some of those gaps, and the capacity building funding from the city is going to be a great help for that. So thank you for voting on that last month. We're also working on hiring a grants and marketing manager who can help us with grants management and performance for that. Lots of reporting involved, especially with the HUD reports. We're working on bringing in professional development opportunities for our nonprofit service providers who don't have budgets for that, and also supporting both the Haven and Potcham as they embark on their strategic planning processes as well. Happy to accept any questions that you all may have.
So, yeah, I'll have some, but it's probably best for me to wait until the others. But are there any questions right now from anyone?
I have a question, Ms. Washington. You've referred to being a lead agency in the continuum of care. I'm just curious, is that a responsibilities only kind of a thing, or do you get some extra money for your agency for being the lead agency? Tell me what that means, really.
Sure. So the lead agency is responsible for applying for federal funding through HUD. We do apply for a planning grant every year, which is the max we can get as our, based on our size of our continuum of care is $50,000. So that goes towards salaries and admin costs.
Okay. I'm
We
glad
also
you
apply
get
for-
something for that. I thought we were just burdening you with.
No, we also apply on behalf of Region 10 for their permanent supportive housing project, which is almost $500,000. And so we're the collaborative applicant for that HUD grant as well.
Okay. Thank you.
Any other questions?
Yeah, thank you for your presentation, and for your work. I don't suppose at this point you have any prognostication in terms of the grant outlook or the funding outlook from HUD at this point, probably.
At this
Yes.
point, no. So we did apply.
Crossing our fingers and hoping for the best.
Yeah, that's pretty much it. Piedmont Housing Alliance, Sunshine Mathon at PHA has been really great about spearheading these weekly calls about federal funding and what to expect. And so we're all kind of sharing news with each other as we hear it. But a lot of it is kind of wait and see. I know Trump released his skinny budget very recently with plans to cut about 40% from the HUD budget, hoping that doesn't pass. But if it does, we just need to be prepared to kind of pivot and look for other alternative funding sources. So right now it is a fingers crossed wait and see game. We are planning to apply for renewal funding for our PSH program through Region 10 in August, assuming that application does go online when they've promised it to be.
Okay. The other question I have, I don't know if it's possible to bring back up the slides, but the slide where you were showing where the unsheltered are from,
I do not know how to get it back on the screen. I'm
that's
sorry.
fine. It's okay.
It's coming.
Thank you. I'm hitting the back button, I promise.
You're going forward.
I'm trying to hit the back button.
There
There we go.
Yeah,
Sorry about that.
it's okay. So 157 of 241, so that's, what is that,
44%.
96, 86, 84, whatever. I'm struggling with my math, but, so you had 84 folks. So 107 plus 40 plus 84 plus those others equals 241. Okay. All right, so the 84, either they weren't responsive or you just really have no sense of where they're coming from?
Correct. And I'm sure, once our service providers come up, they can give more intel into that because most of the folks who are collected in this management system are either staying at Salvation Army or Potcham. There are some who are unsheltered, but most of them are coming from our shelters that we are able
Do we
to
have any
capture.
idea, particularly for the folks that are from Charlottesville, from the county, how it is they're ending up in homelessness? Do we have any, is it, is there like a common thread, just that they weren't able to, or they were evicted, or is there illness that's, is there anything that you could share that's sort of or maybe each case is just unique?
I think for the most part, each case is unique. I will say there are a lot of evictions happening just because of rising rents and people not being able to afford it. The cost of living is very high here, and so, you miss 1 month of rent and you're automatically up for eviction, once you go through that process with your landlord. It's very expensive to live here, and the people who are from here want to stay here. And so sometimes it does mean sleeping on the streets because they don't want to leave the only home they've ever known. I've
Yeah.
talked to many people in that respect who just don't want to leave Charlottesville for whatever reason, no matter the fact that they can't afford it.
Yeah. I think there's a narrative out there, I don't know how true it is, but I've been doing a lot of door knocking recently and talking with people really all over the city, and there's definitely a narrative that, you know, Charlottesville has a reputation for being hospitable, which I hope that's true. We're close to the I-64 and close to I-81 and not far away from Richmond, and so there's at least a notion out there that we end up sort of pulling some folks in who might go other places. Do you have any sense of that?
Again, I think our service providers who are doing the direct service work can speak more to that, but I think that there are a lot of really great resources here. UVA Hospital, our social services and human services programs are very robust. I do think that people who come here probably don't stay here for very long if they're not from here, just because of the rising rents and the fact that people can't afford it in general. There's a common misconception that people are being bused here from other communities. I don't see that happening.
Okay. That's helpful. Thank you.
Any more questions right now? Oh.
Yeah, do you want to go? Can you tell, you know, you mentioned some of the HUD funding that's up in the air. Can you tell us a little bit more about your other funding sources?
Yes, we get roughly, I would say 60% from the state, so the Department of Community and Housing Development, DHCD. They give us funding for coordinated entry, rapid rehousing, homeless prevention, our HMIS, or Homeless Management Information System, and some for planning dollars, so COC planning. But that is our biggest source of funding. We also get some funding, I would say about 4% from local, 4% from private donors and 6% from local dollars, so Albemarle County and the city.
Okay, that was going to be my next question, is I know the city pitches in a little bit. I was going to ask how much the county contributes.
Yeah, currently it's 6%.
Okay, thank you. And sorry, that's 6% combined from county and city?
Oh, I'm sorry, yeah, that is combined, city and county
Thank you.
dollars.
Michael?
Likewise, I think I'll save my questions to the end of everyone's presentations.
Thank you.
Thank you.
Thank you, Shayla. I know you're out there. I'm in a lot of meetings and you're there representing, so
Thank you.
thank you.
Trying to locate myself on the slide deck, and I'll say, but hello, city councilors, city
Hello,
manager.
hello.
Good to see you all. Thank you for inviting us. My name's Owen Brennan. I'm the executive director of The Haven. As many of you probably know, The Haven is the day shelter. We are open 365 days a year, located just off the downtown mall. We offer respite care for anyone in need every day of the year. In addition to that, we also provide housing resources to help folks, prevent folks from falling into homelessness, and to help folks exit homelessness once they've found themselves there. And yeah, we open our doors wide for anyone and everyone, no matter their circumstances. We are a low barrier shelter. There's been a lot of talk about low barrier versus high barrier shelters in our community. So we are oriented for folks who truly have no place else to go, folks who are experiencing sometimes mental health crises, are struggling with addiction. Despite that, we are a community of folks, staff and guests who care about each other, and we really aim to provide radical hospitality for anyone who comes, and a safe and welcoming space for folks to begin again and get back on their feet. We work closely with Brock, obviously. We work really in tandem with them. Brock sort of does the 30,000 foot planning and strategic work for our COC. And The Haven has long been sort of the direct service provider, one along with Pacha and the Salvation Army, who are directly serving our homeless neighbors. I mentioned our day shelter. We are open 365 days a year. We serve breakfast every day of the year. Lunch on Fridays and Sundays. Folks can take showers, do laundry, access computers. They can get their mail sent to our address. We sort a lot of mail every day and distribute it to folks. And then we have really built a strong in-house programming including we have a partnership with UVA Health. They have a health clinic that comes every Wednesday afternoon, sets up and does primary care visits with anyone, any of our guests who want to see a primary care provider, and then they refer folks to UVA for specialist visits. They have in-house psychiatry as well that they provide. Over the last year, and it's something that my predecessor, Anna Mendez, set up, was a partnership with the an opioid-based or office-based opioid treatment program out of UVA Health. So every Wednesday, there's a team of nurses and counselors who are showing up and meeting with anyone who's struggling with addiction, is trying to use less, anyone who's trying to end that cycle of addiction. And they have been just a tremendous partner as far as working with folks, not just on addiction, but also on getting housed, which is really what all of our services are oriented towards. Homelessness is a housing crisis, and so we want to provide a welcoming space for folks, but we don't want folks to stay with us forever. We want to move them to their next stable housing situation. Just a quick snapshot. This is data for the last 9 months, ending end of March. We had 21,715 visits to the day shelter. That breaks down to about 80 people per day. We served 20,000 meals. I think that's like 75 meals a day over that time period. And then we saw 412 unique guests. So of the 80 people who were showing up every day, a lot of those folks are in transition. Most folks who experience homelessness in our community, it is pretty brief, a month or two. And then we have folks who have been experiencing homelessness for a number of years. Those are the folks who we target with our housing programs. So once we have welcomed folks, we have fed them, then as quickly as possible, we're trying to connect them with our housing programs and a way out of homelessness. We operate the homeless intake hotline, or the homeless information line, which provides the first step for someone. This is for anyone who is either experiencing homelessness or is at risk of experiencing homelessness, can call the homeless information line and speak with someone who's going to triage their situation. If they are currently experiencing homelessness, they're going to be referred to one of our housing programs. If they're at risk of homelessness, depending on how close their eviction date is, we may be able to serve them with our homelessness prevention program. Homelessness prevention provides financial assistance up to $3,500 to pay either rental arrears or to move someone who is about to be evicted into a new place if they're not allowed to, if they're not able to renew their lease where they are currently. To be eligible for that program, someone has to be within 14 days of losing their rental unit. So these are folks really, who are on the verge of eviction. We have limited homelessness prevention funds, which we get from the state, about $100,000 every year. So we're really trying to identify who are the folks who are have an eviction court date, but are most likely to actually enter shelter. If someone has already lost their housing, they are currently homeless, they may be sleeping in a shelter, either the Salvation Army or Pacham, or the She Shelter, or they may be sleeping outside in a tent, in their car, or some other place that's not fit for habitation. Those folks are then eligible for either the Laura DeLapp Haven Housing Fund or our Rapid Rehousing Program. We've been administering the Rapid Rehousing Program the longest. This is a federal program, and our community focuses those resources on the individuals who have been homeless for the longest time and have the most serious medical psychiatric conditions. So we house about 40 households every year through our Rapid Rehousing Program. This is a really robust program that provides rental subsidies, but then also case management support for up to 2 years. And the goal of that program is to bridge someone from the subsidy to being able to either pay their rent on their own or connecting them with a long-term housing voucher. After administering rapid rehousing for many years, and seeing a number of folks who have been chronically homeless moving out of homelessness, we realized there was this big gap. Folks who had not been chronically homeless, been homeless for a short period of time, had some kind of income coming in, just needed a light touch to get out of homelessness. So we started the Haven Housing Fund. It was renamed for our beloved coworker, Laura DeLapp, who was tragically murdered a few years ago. And the Laura DeLapp Haven Housing Fund provides that light touch financial assistance to help bridge people out of homelessness into housing. Security deposit, first month's rent, and then those folks have income, can pick up their rent and continue on. So we receive a lot of calls to the homeless information line. A lot of these calls are from folks who are behind on their rent, but don't qualify for our homelessness prevention program. So we refer them to either the City Pathways program or to the Albemarle County ACER program. I do want to note that the overwhelming majority of callers are from either Charlottesville or Albemarle. We have 49% of callers are from the city, about 40% are from Albemarle County, and then the balance is from the other counties that are in our catchment area, Louisa, Greene, Fluvanna, and Nelson. There was the discussion of, is Charlottesville a hospitable community, so hospitable that we're attracting people to our services? And as someone who works with the folks who are entering homelessness for the first time, I can pretty emphatically say that the folks who are experiencing homelessness in Charlottesville are very local. They're from Charlottesville, they're from Albemarle. And folks experiencing homelessness don't have the sort of resources to move around and shop around for resources. That's not something we have seen. In our day shelter, if we identify that someone has another place, either family or friends they can stay with, they have to confirm that they have got a safe place to stay, but we will pay the $100, $150 for someone's bus or train fare. I use that example just to illustrate that our guests don't have an extra $100 or $150 to find a better location to get services. So in our experience, our folks are very local. The last collaboration that I want to highlight is collaboration with the Department of Human Services here with the city. We had a brutal winter, and there were 3 stretches of nights where either the temperature was so cold or we got so much snow that people and the Pacham and Salvation Army demand for overnight shelter just skyrocketed in that time. The city offered to pay for hotel rooms for anyone who wasn't able to access Pacham or the Salvation Army in these 3 stretches of time, and our staff coordinated with hotels to house a total of, I think it's 40 unique people over these 3 periods of time, for a total of about 140 nights for everyone. And that was a really great collaboration. Thanks to Misty for helping out with that. And Ashley Marshall also made that happen. So we're really grateful for the partnership with the city for that. And just in general, we don't get, we get a very small amount of federal funds for our rapid rehousing program. Our housing programs are largely funded through a state agency, DHCD. But our day shelter is really funded through private funds, foundations, grants, and the city of Charlottesville has been a big supporter of that through the HOPS program as well. So that is an overview. Happy to take any questions.
I'll start with you. I think, Mike, are you going to wait until the end, or you have something you want to ask now?
Sure, I can. So in terms of the programs you have to move people out of homelessness into a permanent house, the rapid rehousing is about 40 people a year, and then kind of what's the scale of which you're able to...
Yes, I'm sorry that those numbers didn't make it in. Let's see, so between prevention and Laura DeLapp Haven Housing Fund, we have served another 109 households over the first 9 months of the year. and then another 40 through rapid rehousing.
And then, trying to say it's not the right approach, but with rapid rehousing, are you finding that program, in terms of being targeted for people who have been the longest in chronic homelessness, that program is most effective or working for that? Or is it really just like a triage situation where the amount of funding and programs that exists is so poor that you're just kind of like forced to use it for that purpose? Like,
No, that's been so Brock set that priority about 15 years ago. This is how we're going to prioritize using rapid rehousing funds. And so, yeah, this is a case in which we work closely with Brock to sort of set those priorities. A number of other communities target folks with less intense needs. And again, that's what the Laura DeLapp Haven Housing Fund was created to serve a very similar purpose to how rapid rehousing works in other communities.
right. And again, recognizing it's like a triage situation, like you said, there's a 2-year limit on that program. Are you
Yes,
finding
absolutely.
that creates a barrier where for some people that 2 years is just not enough and they're kind of cycling back into homelessness? Or is the success rate, 80, 90%,
Yeah, that's a great question. The success rate is around 90%. So and most folks at this point are not staying in that program for 2 years. We did have a ton of emergency housing vouchers come through our community over the last 5 years. So a lot of folks were moved from rapid rehousing to an emergency housing voucher. Some folks get either working income or work with our case managers to get Social Security disability income to pay their rents going forward. But yeah, that program is really successful as far as stabilizing someone when they exit the program.
Okay. And I guess with the emergency housing vouchers, what kind of agencies are those coming from? And then, what's the scale of the problem you've encountered where maybe someone gets that voucher, but they can't find a unit that will accept it for various reasons?
Sure, that's a great question. So my understanding is emergency housing vouchers come from HUD to localities. So I think that both Albemarle County and the city of Charlottesville housing authorities administer those. What was your second question?
Just like, to what extent do you, because I know with like Section 8 vouchers, a lot of people encounter the problem where they get the voucher, but they can't find a unit that is at the rent level to accept it.
Sure. For folks who are enrolled in our housing programs, the case managers are working with them doing housing navigation. So there's not a bottleneck for rapid rehousing clients. We're trying to find a way to sort of spread the housing navigation resources throughout our day shelter, because we do have folks who may get a mainstream housing voucher, whether Section 8 or something like that, currently homeless, and they need assistance finding a place. So that is, without a doubt, a need that we've identified is community-wide, and is something that at the Haven we're trying to build out, so like volunteer support for that work, because it is a really critical need in the community.
Yeah, and I know with Section 8 vouchers, I'm sure it applies, there's just not, even with all the navigation, sometimes there's just not open units that are low enough rent where if the rent's too high, HUD doesn't, you can't use the voucher there and have it be affordable. So I
True,
just wonder
yeah.
to the extent that's a problem.
Yeah,
But no, yeah, that's all very helpful. Thank you.
sure, thank you.
Yeah.
Kind of on that same vein, I'm wondering, where are you finding the housing for these folks? Is it within city limits? Is it far out there? Like, where are folks landing?
Yeah, it's a mix. We're generally housing folks within Charlottesville and Albemarle. If someone has access to Jaunt or their own automobile, we may look like to outside of the urban ring, but 90% of the folks we're housing are within Charlottesville and Albemarle. And I mean, our housing team is really terrific at partnering with private landlords, property management companies, building relationships with landlords. That work really depends on strong relationships with landlords who know that if we house someone with them, we're going to be there to support that person and be able to troubleshoot any problems that might arise. But yeah, that's someplace where our housing team has really shown in navigating folks into places. So the limit for us is not yet like not having places to put people when they've been identified for rapid rehousing. We can usually house someone in 1, maybe 2 months at the most.
Okay, thank you.
Sure.
Brian, you have anything?
Yeah, a couple of things. Has the Haven considered the possibility of actually becoming not only a day shelter, but an evening shelter as well? Is that something that, my understanding is that you've asked those questions and it is cost prohibitive to do that, or it's just not really your model? Is there anything you could say to that?
Yeah, I guess I can only speak, I came on as interim director last July, and at that point, the conversation between Pacham and the Salvation Army as far as creating that low barrier shelter option had sort of begun to move. And so we're very supportive of that project of expanding low barrier overnight shelter year round for our community. And we're also, I mean, our MO has always been like, what does the community need and how can we provide it? So we're open to, creative options for providing overnight shelter if that's, if that
Thank you.
is a
Yeah,
need.
thank you for that. If there was if you could sort of Hermione Granger up a list of, a couple of 2, 3 interventions that you wish, or funds that could just be sort of, gifted to the Haven, are there some sort of ideas you might have, sort of like to really make a step change in how the unhoused are served here? Can you?
Yeah,
Are things that on your wish list?
That's a great question.
Without, I know you've got a board that,
Yeah.
and so you're limited in what you could, I guess, say. But I mean, being creative. What are ways that you think could make a big difference?
Sure. I mean, it is true that there's more demand for our homelessness prevention subsidies than we can meet.
Okay.
So we have more people who are being evicted who have a high likelihood of entering homelessness than we can pay rental arrears for.
Okay.
And if we can stabilize the rental market by having enough funding to prevent all the folks who are about to fall into homelessness, then that would give us a better sense of what is the rental market right now. Because right now, to some extent, our housing model is dependent on folks being evicted from places so that we can, and then new folks moving into those units. So the easiest thing to do is to keep someone housed.
Right.
We don't have to navigate them. We just pay their rental arrears and keep in touch with them to see how are they doing. But I would identify as that sort of the lowest hanging fruit in the homelessness response system.
Got it.
Can I ask a quick question?
Sure.
So it sounds kind of like, you said that the model is kind of predicated on housing becoming available by people leaving and then having to find. So wouldn't another option be we have more housing available, full stop?
Absolutely. And I am remiss in stumping for affordable housing. I know you all know this but with what we ultimately need is more affordable housing. Absolutely. Yeah, 100%. The stopgap between now and then, and also to figure out how much affordable housing do we need. It's not all folks being evicted. Folks are moving to different places, so the rental market's in flux. But as far as stabilizing the number of
So
folks,
is this like a couple hundred units, family units, or people a year?
I think that's what has been identified as the affordable housing gap between Charlottesville and Albemarle.
And
Specifically for the unhoused, I mean, the folks that are right on the hairy edge of being kicked out of their. Am I making sense? In other words, the folks that are on the very knife's edge of being displaced from where they are, that's several hundred a year, perhaps?
Well, that's a harder number to nail down because probably thousands of people go through the eviction process every year.
Okay.
Of those folks, not all become homeless.
Okay.
some find other rental options, or they double up with family, or they find some other solution. So I am sort of targeted on folks who are evicted, and then the subset of evictions that result in homelessness.
Okay, we're gonna have to scoot because we have several more presentations and another, so Lloyd, did you have anything?
I have no questions.
Okay.
I'm sorry, just one quick one. You mentioned you were counting in terms of households earlier, and I know that is a catch-all term. How many of those are individuals versus families? Do you have a, estimate?
Yeah, it's probably 20% families,
Okay.
80% individuals.
Okay, thank you.
Thank you,
Yeah.
we gotta move on. Thank you.
Thank you.
I forgot who was next.
Shelter for Help in Emergency.
Oh. Did you have any fond memories of when you was like, oh, yeah, yeah?
Oh my goodness. Good afternoon, everyone. I am Anna Mendez. I have the privilege of being the executive of the Shelter for Help in Emergency. It is lovely to be here with you this afternoon. I do want to say that I am so heartened to see so many youth in the audience. Thank you guys all for being here, and please keep showing up. With that, I'm going to see if I can make this work. Here we go. All right, Shelter for Help in Emergency. We are the regional wraparound service provider for people who have experienced intimate partner violence, and also as much work as we do to meet the needs of those who have already experienced violence, we are also working with primary prevention strategies so that people neither experience violence in their lives nor become people who perpetuate violence as well. There are a lot of words on this slide. What I would like to draw your attention to is at the very bottom. Make informed decisions for themselves. That is both the hardest and most important part of our philosophy at the shelter. What that means is that we work incredibly hard not to recreate the cycle of power and control that people coming to us are seeking to flee. In other words, we do not tell people what they should do, which can create some really hard situations. We also firmly believe that people are the experts on themselves, and they know when they are most ready and when it is safest for them to leave the situation that they're in. We are the only intimate partner violence organization that serves Planning District 10. Our outreach office is directly across the street from Albemarle High School. Our emergency shelter facility is located at an undisclosed location in the kind of urban core of Charlottesville and Albemarle. We primarily serve Planning District 10, but we do provide shelter services to people who live in other locations in Virginia. And that is because we want those localities to extend the same consideration to us when we are full and have a survivor who needs housing tonight. We would love to be able to make sure that if there's a bed in Stanton, that the Stanton IPV organization is willing to step up. And so we extend that same consideration to our partner organizations. Before I move on, something that we as an organization are working hard to do a better job at is to be more accurate and precise with our terms. So while you may hear the terms domestic violence and intimate partner violence used interchangeably, and while perhaps we may still use them interchangeably on our website, they are not, in fact, the same. So we are working particularly to end or prevent patterns of behavior that work to establish or maintain power and control over someone's current or former romantic partner. So how that is relevant to this conversation is that we are unable to offer shelter to people who have experienced domestic violence that is not, in fact, intimate partner violence. So for example, if your roommate who is just your roommate not your romantic partner, assaults you, you are not eligible for shelter at our service. Same if you're living with a cousin, if your adult child has serious mental illness and is living with you and there is a domestic disturbance in the home, that is not intimate partner violence. And so I just am grateful for this opportunity to state very clearly what the boundaries and limitations of our service provision are. And we provide a lot of service in the community. We answer a 24-hour, 7 days a week crisis hotline. We offer emergency shelter. We provide resource assistance, both financial and tangible goods, to people fleeing intimate partner violence. Information and referral sources, legal advocacy, and court accompaniment. We cannot yet currently provide legal representation in court, though that is something we hope to be able to change in the future. We have 24-hour-a-day access to a language line, so we can actually provide all of our services to any language that people may speak. But we also have staff on site who are themselves Spanish is their first language, so that is why we emphasize Spanish-speaking services on here. We are our community's access point to the statewide address confidentiality program that people can access through the Attorney General's office if you are in a stalking situation and it is not safe for your home address to be a matter of public record. We also offer prevention and education programs in the community. We have a pet safe program because not having a safe place for your pet to go when you need to come into emergency shelter can be a really significant barrier for people. In 2024, we provided over 6,000 shelter nights to individuals who needed shelter. We answered over 1,400 hotline calls, and we helped community members secure over 100 orders of protection. One thing I will say that is very relevant to this conversation is that of those 1,400 hotline calls, slightly less than half of them were individuals who were seeking shelter but had not experienced intimate partner violence, which is partly on us. Our name is the Shelter for Help in Emergency, so it would stand to reason if you are someone about to experience homelessness that you would think calling us would be a next first step for you. But those calls are really heartbreaking for us because we don't have a solution for that person. And that person also can often become pretty frustrated that they've reached out for help only to discover that we are not a solution for them. We work with law enforcement partners in our planning district to do real-time lethality assessment screenings with them when they are actually in the field responding to a call that either toned out as a domestic violence call or perhaps didn't, but by the time they got there, the officer was able to see that yes, there is an intimate partner violence situation happening here and we need to do a screening. People that are screened through that assessment and are looking for shelter are able to be kind of like fast-tracked for shelter if they so desire with us. We also work in many local public and private K through 12 schools doing semester-long youth education around prevention, and we are really, really grateful to be able to do that because ultimately we would like to not have to have a shelter building serving this community. And then just about every weekend of the year, we are out at a fair, a festival, a community event, working to teach the community who we are, what we do, and what services we offer. Before I stop talking to take questions, two things that I think are important for me to mention is we've recently taken kind of an audit of how can we help the people who are coming into our shelter be more successful. And as a result of that, we have changed our policy around bringing dependents into shelter. So I'm grateful to be able to announce that now anyone who is eligible for shelter can bring any number of dependents with them when they come, as long as that dependent was living with them at the time of the intimate partner violence. We no longer have any restrictions on ages or genders or relationship of those dependents to the survivor. Recognizing as well how difficult it is for people to leave our shelter and be able to find their next stable situation, we have also recently increased the length of stay that someone can be with us. And on one level, we're really grateful to be able to do this for individuals because we want to help them be as well set up for success as possible. On the other hand, extending length of stay does not magically increase the number of bedrooms that we have. So we also recognize that by in so doing that, we are likely reducing the unique number of people or households that we're able to serve in a year. And so we're going to continue to do some data analysis to try to find what is the length of stay that best helps get people launched into stability while also recognizing what a life-saving service we are providing for people who haven't yet been able to meet us. So very excited to take any questions that you have.
Okay. So, Lloyd, I'll start with you.
I don't have any questions.
Right.
Good, thank you.
Quick question, just on what you just said. For the people who are extending their stay, what are the reasons that people extend the stay? Is it that they
Lack
can-
of housing.
Housing on their own, yeah, okay. They were mentally ready to go out, but
Yes.
there's just not,
There's
the
just
supply
no,
doesn't
there
exist.
is just no place for them to go. Yeah.
okay, thank you.
And I know we've got two other organizations, so I'll just keep it to one. But for what are the programs you're relying on the most, that people are accessing the most in order to move into housing? Is it also similar to the Haven, those emergency vouchers, or is it more traditional Section 8 vouchers that they're having to wait for? Or
We are primarily helping people be able to access market rate housing. It's just it just takes time to be able to be somewhere long enough where you can save up enough of the money that you are earning to then be able to sign a lease with a deposit and first month's rent. And then perhaps if you don't have a strong credit history, maybe there's also like an additional deposit that you have to do as well. For many of the people who come into shelter with us, their name is already on a lease and they are a co-leasee with their abuser. And so in Virginia, if the person wants to pursue a criminal legal remedy and we are able to help them get a protective order, once they have received that protective order allows them, provides a way for them to be immediately released from that lease so that then they can lease up somewhere else. But that all takes time, unfortunately.
right, but less
Yeah,
permanent subsidy.
exactly.
Okay, thank you.
You're welcome.
Thank you so much.
You're welcome. Thank you.
Good to see you. Mark?
Good afternoon. My name is Major Mark Van Meter with the Salvation Army, and I appreciate being here with the other service providers in the community. I think this is now my 6th community I've served for the Salvation Army, and in all honesty, I've never found a more cohesive group of service providers who want to work together. Just a little bit about the Salvation Army, and I'll try to move along for the sake of our wonderful time here. The Salvation Army provides a soup kitchen 365 days a year. The rumor is we have one of the best Thanksgiving meals in the community, and that's due to faithful people who come out on Thanksgiving Day and serve and provide a great meal. We have food 7 days a week, Monday through Sunday, breakfast and lunch. I'm sorry, on Sundays it is just breakfast and lunch, and the rest of the days it's breakfast, lunch, and dinner. We have a 58-bed shelter here in the community, and we partner with Blue Ridge Food Bank's rescue program and other food programs to provide into the community. You are probably aware of our Center of Hope project going on at 207 Ridge Street. On the on my right, probably your left, the Highbury Emergency Shelter that we are proposing includes 114 beds for sheltering in the community, an expanded dining room. Currently, we have about 50 seats for feeding, but the new facility will have 120 chairs. And we would certainly hope this would never be needed, but we are planning for the next COVID outbreak type situation with our air conditioning and containment areas, sick bays for people to have respite. In addition, this new building has 7 transitional apartments for families, and they are 2-bedroom, 2-bed apartments, and we're looking forward to providing those. And then you're all aware of the conversation about the year-round low-barrier shelter. And that will be 50 beds initially, and there will be some space provided for offices, meeting area, and if necessary, eventually expanding the low-barrier shelter to 100 beds. I, again, want to express my appreciation to Patcham and Brock and the Haven, our conversations we've had about how to best utilize this space and partner together to make it a comprehensive community effort for the low barrier shelter in the community. Just 2024 by the numbers, so you can get a snapshot. There was approximately 1,900 cases that we assisted, representing 4,500 unique individuals. There were 16,000 nights of lodging provided in our shelter. My quick math tells me that's approximately 45 individuals per night, representing about 75% capacity of our shelter. The little sub-point under that, one of the things that my wife and I initiated when we got here in Charlottesville was that we weren't just providing emergency sheltering, but we were also working to help individuals get out of the perpetual cycle of homelessness. And I'm pleased to share that currently we see on average between 10, 11 individuals leaving our shelter monthly with stabilized housing and employment. And that's really the outcome that we like to see. 54,000 meals provided in our little soup kitchen, and we anticipate in the new facility that we'll push closer to 90,000 meals very quickly. On the other side there, 750 hygiene orders. These are people who really cannot even afford basics: soap, laundry soap, shampoos. In addition, another 1,300 grocery bags of food sent out, and then just over $17,000 worth of vouchers that we submit to our thrift store for goods in the community. And that number really, you know, it's guys that are getting jobs on road crews, or they're getting ready to work at one of the local restaurants, and we can provide them with a nice polo shirt and nice slacks and those sort of things. So that's what our thrift store is used for on the regular. There was a snapshot taken in 2024, September 2024, that showed 30 to 35% of our clients are regularly referred to us by hospitals or Region 10 for respite care, if you will, at our facility. And that's an annual number, about 1/3. On September 10th, we just grabbed a unique date 7 out of 39 folks in our shelter had been referred to us by the local hospitals. So these are individuals who, the conversation has been, where are the homeless coming from? Are they coming from out of town? Some are. There might be an individual from Lynchburg who's having some treatment at UVA, but these numbers kind of represent some of that. That does not necessarily mean they're permanently homeless in our community, but nonetheless, they are homeless for a period of time. And then we recognize on average 13 calls per week from hospitals and healthcare institutions seeking a facility for individuals to come and stay. The Salvation Army provides $1 million a year in direct and indirect services to the community. And we're very pleased to be able to do that. We receive no state, federal, county, or city funding specifically for our social service programs. Those are all dollars generated by our donors in the community. We're hoping to change that. We have to change that, especially in our new facility. And so we're looking forward to increasing our relationships, not only with our other partner service providers, but also the city and county as well, as we attempt to serve those in the community. So I've tried to keep my time brief. Any questions or anything that I can share?
Any questions, Natalie and stuff?
Just briefly, I want to thank you, sir, for your initiative and willingness to be creative and helping us put some solutions together. There's still more work to be done for sure, but you've been a real breath of fresh air, I think, in terms of helping us be creative and show initiative as far as ways to improve our delivery in this area. So thank
Good.
you.
Yeah, thank you so much.
Thank you, Mark.
All right.
Hello.
Hey there, I'm Cindy Chambers. I'm the Deputy Director of Pacham. You all probably know us. We've been in the community 21 years now. Our organization was built on a collective of congregations, and it continues to be kind of central to our work, that sense of collective collaboration. We are a very small agency, 5 year-round staff, and about 30 seasonal staff to make it all work, and hundreds of volunteers. There's roughly 50 congregations that are pretty active with us, that help us run our services. And we've recently been trying to kind of figure out what would that look like if they weren't offering that service. So for 2 weeks of sheltering men through our shelter program that serves 35 men every night, for 2 weeks of that, it costs roughly $17,000 is what one of our recent congregations told us. If you're counting the food they're spending, the space that you would need to rent, all of the utilities. So this really is an organization that is community built that a lot of folks are putting their time and effort into. So just want to emphasize a lot of our partners are in the room, but also first responders are a big part of our work. I just want to emphasize how much it matters that we work with the Anchor and Heart teams, which are the crisis response teams, and a lot of calls from emergency rooms that would like to discharge folks. And so it's important that we maintain that health connection in our work. So our low barrier cold weather shelter operates roughly mid-fall to mid-spring. We serve 30 to 40 men roughly every night and 15 to 16 women. I will say on any given night we have more men showing up than we have beds. We host at different congregations mainly, although we'll look for anywhere to host that has the facilities. And so we move every 2 weeks during this time. Just to kind of explain a little bit about low barrier shelter, it's a harm reduction approach. I think Owen at the Haven kind of explained this. We serve people on all levels of where they are and maybe their decisions about changing their life. And what that means is that we remove as many barriers as possible to make it accessible. So you don't have to have an ID to come to our shelter. You don't have to be sober. You don't have to have a job. We don't make you do case management. We don't even make you pre-register. You just got to show up. We keep an amnesty box, so we hold if people have any like kind of weapons like knives or tools, recognizing that they keep that on them to be safe on the street. So we hold those things so they don't come into the space at night. And we also offer transportation. So if CAT is not running, which is every Sunday, and if the church is not on a CAT line, we offer transportation. We spent roughly $24,000 on that this year, and about $9,000 was through CDBG funding. So we served roughly the same number of folks as we did last year, a little under 300 folks. I do want to point out just 15% of them have used our shelter at least twice in the last 3 years, and 3% every year. These are folks that we are talking about how do we better target our resources to, right? I don't want this to be a housing plan for folks. If you just ask me, you know, what's a common, if I just asked who's using this shelter, I would picture an African-American man who's 55. Roughly 70% of the folks we serve are men. And we have a disproportionate number of BIPOC individuals using our services compared to the folks that live in our community. So an overrepresentation of folks experiencing homelessness. Hitting on the same data there, roughly most of the folks we serve are from our city, if not the county. And I think you had some questions about where folks come from. We do have some folks that come from out of state or other jurisdictions, typically not here for very long, coming through. But the people who consistently have been coming every night are from Charlottesville or Albemarle. We do receive referrals from both the police and hospitals. I mentioned that just because of that kind of cycle of when folks have nowhere to go, they often end up at the hospital, and also their health declines. So as we're kind of thinking of creative ways to help folks, an essential partner in this are our medical systems like UVA and Martha Jeff. We had an increase this year in folks who had higher medical needs. And so if you're thinking about where you're going to house that person into permanently, you often have to think of their health needs to figure out that solution. We talked about that. So about half the folks that come to us have no income that they report. Of those who do report income, which is about 25% of folks, most of them, their income is Social Security benefits, disability. And I share that to kind of point out, you know, when we're looking for housing, if they have income, they're making roughly $970 a month. So we have to find somewhere to house folks with that much income. It's tough to get kind of where folks go when they leave us because they're going all over, and we don't have the same folks every night. But I did want to share some of our positive exits, which the slides are out of order. 32 guests moved to permanent housing, and that could be anything from fair market rent to assisted living. And 14 guests moved to temporary housing, which is typically the Salvation Army. About 40% of our guests report having a mental health diagnosis, and that was about the same as last year. And I just share that as kind of, when you are thinking about low barrier shelter, one of the most common things we are doing is managing behavior. We have a lot of folks that have a lot of needs who may be of different levels of sobriety. And so thinking about the needs we have, we're currently trying to problem solve over how do we deliver more mental health services on site. You may not know that we have a small but mighty housing program called Secure Housing. We looked at those who are most vulnerable on the street, different subpopulations, and we decided to target older adults and women. These are both folks who may be more likely to experience violence or exploitation if they're left out on the street. So that is who we work with. It's anybody who comes through our shelter, uses it regularly, and has a steady income. And so I do share, it's what we would consider kind of a medium supportive program. You do have to have income to do it because we don't have vouchers. Ours is simply money for deposits, and then a little money if you maybe fall behind. But it's 1 year of mainly case management support and housing navigation. So we successfully served 25 folks, and we were able to move people into housing this year a lot through our relationships with landlords, which I think you've heard over and over. It's kind of the only way you're getting folks inside. I'll highlight that Attain on 5th, formerly known as Cavalier Crossings, worked with us to come up with a way to house 8 individuals for the summer at a very low rent. And that we also work a lot with the congregations. We try to recruit folks who maybe their kids have grown up and moved out of the house, so they have some empty rooms. Anything to creatively find a way to house someone. I just want to point out. So we had 83 people do case management with us this year. And I can't emphasize enough that that is what makes us more than a drop-in hypothermia shelter, is the case management services. We are focused on getting people out of our it's rough to move night to night to different places, carrying your stuff everywhere. So our focus is trying to find permanent housing options. And I just want to emphasize how important it's been to work with Charlottesville and Albemarle's Adult Protective Services. We've had a few folks who, frankly, were not suited for our environment. Their needs were too great. They required a lot of care. And we anticipate this happening more and more. One of our largest growing populations are seniors that we're serving, those age 55 and up. Questions?
Any questions?
Just thank you for all that you do. Yeah.
Lloyd?
I have no questions.
Brian, did you have any?
No, I don't, thank you.
Michael?
Not questions for Pacham, I'll just say at the end, we get,
So, yeah, we're
Sure.
there. Just comments and questions in
sure.
general.
Just briefly, I know we get this presentation at least once a year, and I think it's very much a time as a flat circle moment of every year. We get an update that the population increased during COVID, it stayed there. And I think it just continues to come down that as a city government, we have to invest in a permanent year-round shelter and then also invest in more permanent supportive housing so people can move out of that shelter into permanent housing. And I think until we make those investments, we're just going to get the same presentations. Which is, I say that for the city government, not a fault to any of you all who are working incredibly hard to fill in the gap as best you can and making a huge difference. But I think it really comes down to that for us as city government.
Yeah. That one?
I have a specific Pacham question. You mentioned all of the congregation sanctuaries, fellowship halls, gyms, et cetera, that contribute space throughout the season. Does UVA contribute anything? Like empty dorms or facilities of any kind, or money?
We explored some options with them, and they weren't able to provide any space for us this year. They mainly help us through having the UVA med school students come, as well as the addiction center services. But no, they are not contributing to our resources.
Okay, thank you.
So I just had a couple of questions, really. I'm not sure which agency would be the best to answer this, but just in general, these are kind of, imagine I'm challenging some questions that I get from the public. And one of those questions is like, what is this community doing about the individuals on the side of the road that's asking for money, So are we actively, I'm asked, are we actively going out there seeing if they need help? Or, so if someone can address that, because I think the public would like to know, and I could use a refresher. So just
So,
kind of the Reader's
Mayor, that-
Digest.
That gets to be me.
Okay,
So when we think of individuals who are at our streets asking for support, the first thing I want to make sure everyone knows is that what they're doing is legal. So as long as we want, of course, them to be safe, we don't want them to accidentally be injured in that process, but also standing there does not mean that they are unsheltered. So those individuals may never come into contact with our friends here that have presented because they may currently be living in shelter. They could be living with a friend, a family member. That could be the way they are staying in a hotel room or even paying for their rent. If those individuals, however, are unsheltered, they of course are more than welcome to be able to work with our participants here. But that is one of those moments where that individual, again, may actually, we know of individuals across the nation who that is part of the way that they make their living, but they actually then leave and go to work. And if we think about it, most people, I think the statistic still holds, roughly 1 in 4 individuals are one paycheck away from being homeless. That means if we think about the amount of people in this room who are 18 and up, there are several of us who may be on that razor's edge away from being homeless, and that just may be one other source of income for them. But that does not mean
Right.
that they are unsheltered.
great.
I know, very unsatisfying answer, but
No, that's what I've been told. But a lot of people ask that
Of
question.
course.
So
Can I
in-
chime in for a second?
Yes.
I wanted to uplift. Shayla is hiring an outreach coordinator. So street outreach is, Michael had pointed out that, we need housing, we need shelter, we also need street outreach. And so there are a couple of organizations that are working on that.
So would a family be treated if someone comes to a shelter with children? Will he or she be treated different if someone comes by, as a single male or female? Are there extra resources, or do you try to get them into housing because we know it has an impact on education, the schooling, and things like that?
Ms. Washington, if you just want to go ahead and take that other podium, I'd appreciate it. One of the things I do want to make sure I uplift, and also from the city perspective, is that the city CPMT as well as the county CPMT did draft a letter to council as well as the Board of Supervisors, uplifting the fact that this community does not have an official family shelter. The Salvation Army provided that supportive services until their facility no longer could provide those services, their current facility. You'll notice it is within Major's plans in the updated facility once they're able to do that building. But at this particular moment, this community, including the county, does not have an official family shelter. So these teams may work to help provide shelter for those individuals in hotels or other options. And your own Department of Human Services does a lot of that work. Number one, trying again, as Owen said, to keep people in their housing. That is one of the most critical things we can do, especially for a family, help stabilize them in that housing, as well as provide them with the access they may need through pathways, for example. If there is intimate partner or domestic violence, calling our friends at SHE to help provide, again, that stability. And then there are some potential other resources to keep them in housing. But there is no official family shelter.
Thank you. Did you have anything?
Everything Ashley said.
She was pretty.
Mostly we're putting
So-
families in
so-
hotel rooms.
Right. I have
we
one
can
more
afford it.
question to kind of channel through the questions that I get just being in the public, and that is like, if someone refuses, help, or they actually, I don't know if the term is want to be unhoused, they don't want shelter, they may come in for a meal, but I don't know, I'm asked that. Does that make sense?
So your question is, how do we respond to folks who don't want to go into shelter?
Do you find that there are individuals who want to be, I don't know, unhoused, that they want the freedom or the flexibility of not being in the shelter?
Yeah, I think it varies person to person, but I think most people who are avoiding shelter is because they, for a number of reasons, they don't want to stay in a congregate setting, they don't want to hear other people snoring, and, having bodily functions right next to them, inches away from them. They don't want to follow the rules in terms of waking up at a certain time and having to be out of the facility and dragging their belongings everywhere they go for the day because there is no 24/7 shelter. I think the folks who are currently choosing to remain unhoused do want housing, though. It's just a matter of finding it.
The right type. Any other questions?
I just have another comment, building off of what Michael said about how this is a really useful and informative presentation, but often the data feels like it's similar year over year. Yes, the city is investing in various programs to try to ameliorate some of these scenarios, but one of the things we can also do up here and on city staff is to allow and to be enthusiastic about housing abundance, not just from city, but from private partners who can also create more units. You know, as we heard, there's only so many units available. We could give people vouchers all day long, but if there's nowhere for them to spend it, if there's no market rate, if there's not enough market rate housing for the people who can afford that, and all of the ladder of opportunity at every level, that's something that we can also be influential in up here is making sure there's just increased housing across the board at every level. Not all of it has to be funded by the city.
Yeah.
You said the average like monthly income is like $930, so it has to be housing where the rent is probably like $400 in order to afford groceries and basic necessities.
Yeah. So, one of the things that we have done is the zoning ordinance that we passed, and of course, we haven't seen the impact, I believe, the true impacts of that probably for many years, but you're right, I just think we need more housing type, and I think that's what the zoning ordinance will do, and a lot of it is by right now, so they'll have to come to us, it should, hopefully it will expedite that.
Yeah, well, that's the goal, and so I'm excited to hear about the updates that are coming
Yeah.
from that in a couple weeks.
Not $400 a month rents.
Yeah. Okay, any other questions? You guys rock. You allow us
you
to
all.
do so much more to extend our reach, our impact, in the community with nonprofits and community partners like you all. Thank you so much.
Thank you for your support.
Thank you all. So, then we're now, Ms. Howard, are you?
Greetings. I'm just here to quickly introduce Youth Council. They waited patiently. They've been
Yes.
doing AP studies and SWL testing, and now they're here to present what they've been working on all year. A few of them have to leave, so I'm going to make it really quickly.
Yes.
We're going to start by having the youth all introduce themselves.
Yes. Mhm.
Hi, I'm Jalen.
Hi, my name is David, and I'm an 8th grader at Buford Middle School.
Hi, my name is Olivia Zumbrin. I'm an 8th grader at Buford Middle School.
Good afternoon, counselors. My name is Madeline Abagnale, and I'm a senior at Renaissance School.
Good afternoon. My name is Nora Erklins, and I'm a freshman at CHS.
Good afternoon. I'm a freshman at CHS. My name is Ishan.
Hi, my name is Lucy Clarence, and I am a sophomore at Charlottesville High School.
Hi, my name is Dylan Greist, and I am also a sophomore at Charlottesville High School.
Hi, my name is Alex Zimmering, and I am a junior at Renaissance High School.
Hi, my name is Zena Parker, and I'm a senior at the Renaissance School. Okay. So we are the Youth Council for the 24-25 cycle, and we decided to focus on mental health and school safety for youth in the community, specifically at Charlottesville High School. Okay.
Youth Council is a group of teenage students that collaborate and work together to look at issues that affect Charlottesville's youth. It is both middle and high school students that work to target issues and then dig deeper into them to find solutions to these issues. So in the early to mid-fall, we looked at the issues that impact Charlottesville's youth, and then from there we looked deeper into that and narrowed it down into 2 research questions. 1, what is the state of youth mental health and sense of safety at CHS? And 2, what resources and actions do students desire when looking at mental health and safety?
So most of us are new faces to youth council, so we started off getting to know each other and starting to share frustrations and viewpoints on certain issues or aspects in Charlottesville City. And then using those viewpoints, we started to narrow them down into certain topics, and we voted on those topics to focus on one of them. And then using that one topic, we formulated our research question, which we saw in the previous slide, and then we started on figuring out ways to collect our data. So we need to know who to reach out to and how we would collect it. So we decided to do focus groups with CHS students in it, and to do that, we sent out invitations for one of our meetings so we could conduct those focus groups. So during that meeting, we conducted our focus group, and then using that data, we collected it, we organized it, then we analyzed it for common themes or common topics that we saw. And then using those themes, we decided to create ideas for actions and next steps.
Okay, so for our methods, we had 2 focus groups with 6 members each, and every member had to have attended CHS for at least 1 year. And then we interviewed them about, during one of our meetings, about sort of how they felt at school, how safety affected their mental health, if they felt that over time things had gotten safer or less safe, and how that impacted things like grades and home life.
Our first finding was that within school personnel there was some miscommunication and lack of trust, and so when we talked to our focus groups, we found out that a lot of students did not really trust or have a strong connection with the people that were supposed to be their trusted adults in the community. So counselors, CSAs, teachers, other staff that are supposed to be helpers. They didn't really offer that much support for mental health issues, especially counselors, and weren't really successful in fulfilling their roles. So some quotes that we have collected as evidence are, "It just seems like counselors are more there to hurt you than to help you. I wish I could talk to my school counselors. Communication issues, I just feel cut off. The reason why I don't talk to most of the adults there are because they're not really doing their job. There's an issue with school counselors. I don't really trust them, and I feel like they're not useful with mental health issues such as solving student issues."
So our second finding was mainly about the student experience at CHS and how that's affecting how they feel about the administrators and also the counselors. And so specifically about the administrators, there's a lot of feeling, especially with the CSAs, which are people that are in the hallways who take students' phones, that taking the student's phone for the entire day and having them in the office is not necessarily productive, especially because it's led to some students at CHS being late to catch their buses after having to wait in line at the end of the school day to get their phone back. We did some brainstorming as a council, as a youth council, and we thought that perhaps teachers taking away phones in class, if that was an issue, would be a better and more beneficial solution. And we don't know how much influence this Charlottesville City Council has over this, but we think especially if allocating any more budget for more counselors at CHS, just because a lot of students at CHS express never actually meeting their counselor or getting an introduction with them, and then they feel like they can't access their counselor if they actually need mental health help, or just help with doing with their classes throughout the school year. And one quote that we collected was, "I feel like there are resources, but they're not being prioritized or maintained." And then our third and last finding was basically about potential actions we can take. So deprioritizing the cell phone policies, strict enforcement, taking away the phones for the whole day, and only allowing to collect them at the end of the school day. Examining the role of CSAs, which are the people in the hallways who are not teachers that take away cell phones. Creating new procedures for school safety was something that we were worried about at the end of the year, or at the beginning of this year, but has actually gotten better. And changing the system from the roots. So another quote we collected was, "I think having better communication as well as a better system feels like it would be a more responsive and less rigid, would be better for building that level of trust."
So, some actions that we believe that we could take to help combat these issues was to have more capacity and funding for counselors, because we feel like the counselors who are currently at in the Charlottesville City Schools not only aren't really being used properly, but also there's kind of seems to be like a barrier between them and students. And another thing is the phone policy, which has been seen by a lot of students to kind of obstruct class when like counselors come in and they take phones, and it kind of messes with the flow of class. And instead having a way where teachers would collect the phones in the front of the class and return them after class would help to prevent these disruptions in class. And another way is to shift the phone policy to teachers, like I stated before, because the CSA are seen kind of, instead of the counselors they're supposed to be, as more of an enforcement role. And yes, that's pretty much it.
Our reflections on what went well is the actual focus groups themselves, collaborating and refining ideas, agreement on topics, and the teamwork.
Some challenges we faced during the year were finding and recruiting people for focus groups, staying positive while talking to people about mental health, and balancing political pressures and voicing opinion without making other people mad.
And then lastly, our suggestions for the next year's Youth Council is to pick a topic that everyone can relate to and provide insight about, be open to listening to different perspectives and speaking your mind, taking advantage of this unique opportunity to have conversations with people from different Charlottesville City Schools, and having fun. Questions?
Yeah. So that was really great. Y'all, I'm glad that I see Vice Chair of the School Board is here. Amanda, thank you for being here. They made some great, I'm not sure that you're planning to make this presentation to the school board. Is that part of the plan? I would definitely recommend that you share it with them, particularly the comments about the counselors. I heard a lot of things that they feel like they're not trusted or accessible. I think that's something that Mr. Malone, the principal, and that he would want to know, and it could be just having more office hours. I'm not sure, but and the young lady that made the recommendations, one of the things that you said that you all had to kind of balance some political pressures. What can someone elaborate on what you meant by that?
So that was in reference to Youngkis's order as far as what cell phones policies were for the school system, and balancing that, which was mandated, and how the school would enact their decisions.
I got it. because we've heard, at least I've heard from some people that they like not having the phones there, but I hear that you know, I didn't think about that if they take it and you have to get it after school, that you might be late for your bus. I think those are things that can be worked out, can't be as intrusive as it is to get them. But those are things, Amanda, so hopefully you took some notes for that, because we do work hand in hand with, for your questions, with the schools for their priorities and their needs. And so, yeah, we'll be looking forward to seeing how we can continue to support them. I know that role of the CSA is being studied now for the SRO officers, and they're going to be probably coming back with some type of recommendations in the fall for the next budget. So I think that's their timeline. So y'all hit the nail on the head with that, you know. So are there any questions or comments from counselors?
Thank y'all for being patient.
Yeah.
And hanging on.
So I just want to note, I did take a picture of one of them, Dylan, because he's part of the youth group in my church, so I kind of know him, so that's why I took pictures of him. So I know him. So, any questions? Any other questions or comments?
Thank you. Really appreciate it.
Yes. Great job. Thank you so much. I think we are going into closed session, so we're going to read on that.
Yeah, this is quite the closed session reading. Pursuant to Section 2.2-3712 of the Virginia Code, I move that the City Council close this open meeting and convene in a closed session as authorized by the Virginia Freedom of Information Act as follows. Under Virginia Code Section 2.2-3711A1 for discussion and consideration of prospective candidates for appointment to the following boards and commissions: Affordable Housing Fund Committee, Board of Architectural Review, Board of Building Code Appeals, Board of Zoning Appeals, CDBG and Home Task Force, Citizen Transportation Advisory Committee, Community Policy and Management Team, Historic Resources Committee, Housing Advisory Committee, Human Rights Commission, JABA Board of Directors, MACA Board, Minority Business Commission, Personnel Appeals Board, Piedmont Virginia Community College Board, Redevelopment and Housing Authority Board, Region 10 Community Services Board, Retirement Commission, Sister Cities Commission, Social Services Advisory Board, Towing Advisory Board, Tree Commission, Vendor Appeals Board, and the Youth Council.
And we'll be back by 6:30. No, yeah. Is there a second?
Second.
Can we vote? Thank you. We'll be back at 6:30.